If artificial intelligence is what revolutionizing technology, immunology is going to revolutionize medicine. Your immune system is this amazing orchestra of soldiers helping to keep your body from getting cancer, fighting infection, doing things every day. It's a natural killer. So its job is to kill bad guys. Often we'll do natural killer cells before the stem cells because it not only helps to boost your immune system, it also has an effect on senescent cells.
Welcome to Ayik Kafa podcast. I have Dr. Adeel Khan with me. I really ran after him to make an interview appointment, but I'm so excited. Welcome, Adeel. I'm going to just give a little briefing about all the amazing things that you're doing or you're creating, inventing. I've been doing this podcast since January, but my journey with stem cells started back in 2020, actually. I heard the conversation of Mel Gibson and about the Panama Stem Cell Infusion Center, let's say. And I've been very interested into them. Before that, we have a plastic surgeon here in Turkey that he was very involved with stem cell. We never exactly knew what type he was using, but he had a partnership with a blood bank in America, so he was able to bring in some. So I can easily say that a good 10 years or even 13 years, starting from my face, then intravenously, then exosomes, etc., I've been really interested and involved into them. But since I did the podcast, I already had 3 different guests that we discussed stem cell. One is a stem cell researcher and exosome researcher, and you can only understand they're very conservative on the new things that it's coming into the market. The second one was a plastic surgeon, actually not plastic surgeon, she's a heart surgeon, but doing all these stem cell procedure like fat graft, autologous stem cell, they're doing the skin biopsy and making it multiply or whatever, however you call it. And last episode was with Christian Drapeau about your own stem cell. So I'm kind of knowledgeable about that. But Adeel, when it comes to you, it's not just stem cell. You are in the forefront of this regenerative medicine. As a young physician, doctor, you are coming up with these gene therapies, specific organ treatments, such as for diabetes, for injuries, etc. You are doing, because I'm a psychologist, it's very interesting. You're doing some vagus nerve injections to help people to get out of their suicide idealization or deep depression. I mean, that's mind-blowing. Also, you're upgrading these stem cells. So welcome to the show. It's so amazing. Let's first start. What is regenerative medicine and where is it going? Because, we know what happened until now, but with what you're exposing to all of us, it's like sci-fi.
Yeah, exactly. And that's, I think what you said is the biggest difference maybe between me and some of your guests. I'm looking at the whole umbrella of regenerative medicine, which is essentially using cell therapy, gene editing or gene therapy, and tissue engineering, and combining those 3 to bring us into the next generation of medicine, which means repairing or restoring dysfunction of organs and tissue back to normal. So instead of cutting things out, or instead of just taking a pill, we'll be able to fix you back to the way you were. So for the classic example is osteoarthritis. Instead of having to take a knee and putting in an artificial joint replacement, we can just regrow cartilage. That's always been the promise of regenerative medicine. And as you can imagine, there was a lot of excitement around stem cells, maybe even 15 years ago when they first started really being used. But then the results weren't very good. And so people were kind of like, this is hocus pocus, it doesn't really work. And so a lot of doctors brushed it off. But it turns out that the science and the research has progressed so much in the last 5 years, and now we really understand how do we get these stem cells to actually survive, how do we get them to actually regrow new tissue and repair damaged tissue. And that's been the hot area of research, and now we can actually standardize these stem cells to do what we want. And that's why this is very exciting for the future, because imagine now when we put a cell into your body, it's kind of like programming a computer program, right? You program it to do what you want. Imagine you can program a cell and you can say, hey, you're going to turn into this type of tissue and we're going to make sure you survive, and this is exactly how you behave. And so that's the new era of genetic and cellular engineering.
That is where the science is now. And probably you're one of the very few clinicians that is applying that. Because based on my understanding of your other interviews and my researches, a couple of concerns. One is, which because I did, and my experience was in Panama, I went there and I didn't feel much of any difference. You know, I'm healthy. I was 50 years old back then. I don't drink. I try to live a healthy life. But besides that, I kept receiving these surveys, like, is your sleep better, is whatever, and nothing really changed. Then when I started asking around, it was more like, you know, well, maybe your system refused it. Or another option was they might be stuck at your lungs. It was not helpful, whatever. All these answers coming my way made me start questioning. So therefore, like, they were kind of discouraging me almost, like, you know, and I also listened to a couple of other people. They were saying in order to get the benefit of a systemic stem cell infusion, you need to do every 2 months. Then you have to stay in this every 6 months you need to repeat. Obviously, you can only imagine like how expensive that would become. And you know, so I was not really sure if it would be something that I need to continue. First of all, I didn't feel any difference. And second of all, what are you guys doing differently than these guys so that it is effective?
So there's many things. I think the first thing people need to understand is when you take a stem cell from fat or bone marrow, or in that case, umbilical cord tissue, the stem cell is actually full of different subpopulations, meaning it's not just one type of cell that makes up a stem cell. I know it sounds confusing because it's like, you know, when you take a stem cell, you would think it's a homogeneous population of just, we have a bunch of stem cells. But it turns out it's actually heterogeneous, meaning you have different subpopulations. Kind of like the way I like to think about it, you know, in high school, you know, you have different cliques. You have like different groups of people who hang out together. That's kind of like when you take a stem cell, those cells, they like to hang out in their own little groups. And so you have cells, you have perivascular, you have something called MUSE cells, which are the ones that we're focusing on, and I'll explain why. So MUSE cells are a subpopulation of these stem cells. They're called multi-lineage differentiating stress-enduring cells. It's a mouthful, but what it means is they can turn into different types of tissue. So they're multi-lineage differentiating, meaning they're pluripotent, which means they can turn into and regenerate and regrow tissue. And they're stress enduring, which means they survive harsh environments. And this was a discovery that was made here in Japan in 2010, or well, 2008, and 2010 is when she published a paper. And so Professor Mary Dazawa. And so this was, unfortunately, it didn't get the attention it probably deserved, but it was a very big discovery in the sense that we realized that, hey, not all stem cells are the same. Some of them actually behave differently, and some of them have more benefits than other ones. And so when you went to Panama and you got those umbilical cord stem cells, they only have 1 to 2% of MUSE cells in them, because MUSE cells are a naturally occurring subpopulation. I have them in my blood. Everyone has them in their blood, naturally occurring. People who actually exercise more have higher levels of MUSE cells too, which is interesting because then they have more of those soldiers to help repair tissue. So MUSE cells, just think of MUSE cells as like the super soldiers that are going to repair and fix things when things are damaged. I always like this analogy. If you think of your city like a body, and you have different districts, and you have buildings, and these buildings over time get damaged, and there's this library where you have all the books, and those books are the kind of the DNA, they're the instructions to kind of how to maintain the city. So over time, this library accumulates damage, and the way to repair it, one of the ways to repair it are these stem cells, right? And so MUSE cells specifically are the ones that are going to survive better and that are going to be better at repairing damaged tissue, damaged DNA. And so by engineering our umbilical cord tissue, instead of having just 2% MUSE cells, you're going to get at least 70%. And this is based off Professor Dazawa's research, where she's shown in clinical trials for stroke and ALS, even myocardial infarction or heart attacks. She's shown in these different really kind of drastic conditions that MUSE cells can be very beneficial. You're essentially getting a MUSE stem cell from umbilical cord tissue. So it's still umbilical cord tissue, but we're just standardizing a cell population. So it becomes more like a drug because now you have standardized cell product, and everyone who gets a treatment is going to have reproducible results because you get the same dose and the same quality every time. Whereas before, you would have different donors and you have different quality, and that's why you wouldn't always get good results, because you have some patients who respond and some don't, because the quality isn't always the same. So lack of standardization has always been a big problem in regenerative medicine. It still is a problem, but we're getting better and better at standardizing it.
Thank you for explaining. So probably that very cautious and systemic and calculated approach of yours comes from, because you're from Canada, and I know that it's not like America or anywhere else that people take things very lightly. You have to be really on top of it, and you have to be, to begin with, it starts with the honesty until a hardworking person, to become a hardworking person. So you're one of them. And I forgot to share at the beginning, you are working in Japan, in Dubai, in Mexico, correct? And you're now opening a place in Estonia. So you're kind of covering the world, and you're standardizing also your institution, which is Eterna Health. So people who are anywhere in the world, whichever location is closer to them, to get these very special treatments, they can go in one of these locations and will always get the same standards, which is like really, really important. But now that you explain about Japan, it makes so much sense that you spent a fair amount of time in Japan.
So the reason I chose Japan was because Professor Yamanaka was given the Nobel Prize for the iPSCs, the induced pluripotent stem cells, which is basically taking that skin biopsy that you were talking about earlier and using transcription factors to reprogram it. And it basically makes these old cells young again. So it's an amazing discovery. However, these cells can cause cancer or tumors, so they weren't used clinically, and they're still not really being used clinically. They're starting to be clinical trials, but these cells are obviously very challenging because there's genetic manipulation, there's cellular reprogramming, and so there's a lot of work that goes into making them. And so MUSE cells, on the other hand, they were also discovered in Japan, and only a few years after the iPSCs, or the Yamanaka cells, and they didn't get much attention, unfortunately, because obviously Yamanaka got all the attention. And so the MUSE cells kind of got forgotten about. But they're an amazing discovery too, because MUSE cells are naturally in our body. You and I both have MUSE cells right now in our body helping repair things. And so you don't need to genetically alter or manipulate anything. They're just there. And so that's the reason why I came to Japan, because I met with the actual scientist who discovered the MUSE cells, and I'm doing some research with her and collaborating with her as well.
I have two questions following that. One is, these MUSE cells, are they in our blood or in our skin or everywhere?
They're in our blood circulating. And so they're not like, because we have something called stem cell niche or niche. Your gut lining in your intestine has to regenerate and repair every 3 to 5 days. So you have a new gut lining every 3 to 5 days. And what helps to cycle that is the stem cell niche that's in the gut, and it comes in, the stem cells come and they help to renew and turn into new tissue, right? So your body's constantly undergoing this cellular metabolism of renewal and regeneration and repair, and MUSE cells are responsible for helping with that repair, but they don't stay in one spot. They circulate throughout your body, and then they go where they're needed. So they have a very strong, what's called homing mechanism, which is why what you said earlier was very accurate, which was that when you got the IV in Panama, most of the stem cells got trapped in your lungs, and they don't go to where they need to. Whereas MUSE cells, they don't get trapped in the lungs as easily, and they actually migrate to different areas, including the brain. And this has been shown in clinical trial with stroke patients, where they're able to get stroke patients to walk again and get them out of disability here in Japan.
Okay, that all these things that I listened about you, I didn't catch that MUSE cell factor. So you are working with MUSE cell, but you are able to program them to become whatever you want?
Yeah, because they're pluripotent. MUSE cells are inherently pluripotent. So that's the beauty of MUSE cells. They're like, they're like those iPSCs we were talking about, but they don't have the risk of cancer. So they don't turn into cancer, and they won't they won't grow uncontrollably. So they have a regulated ability to turn into new types of tissue. So that's why I like them a lot, because of the safety and their ability to turn into any type of tissue, including neurons, including any type of cell, really.
So do you use these from other people or from the persons itself?
You can take them from your own, but the problem with your own is your stem cells age, right? And as you get older, your stem cells get older too. So unfortunately, your stem cells aren't very effective, especially after age 40. So that's problem number one. Problem number two is something called clonal expansion, which means when you grow your body's own stem cells, and if one of those stem cells has some sort of error or problem in the genetics when you grow them, they can actually potentially cause some sort of problem down the road, because when you do the infusion of stem cells from your own body, your immune system doesn't recognize them. So those cells actually stay in your body for a long time, and they could potentially turn into cancer if they had some sort of genetic damage or vulnerability in them. Versus umbilical cord stem cells, which are from healthy donors. And just so you know, and your audience knows, we throw away more than 90% of our samples because they don't have enough MUSE cells in them to begin with. So they have to be very healthy donors. We get them from umbilical cord tissue after C-section birth, and then they go through a rigorous process of testing. And we do the standard infectious disease testing, but we also do like EBV, CMV, and Lyme, which a lot of manufacturers don't do, including Panama. And so it's important to do that type of testing to make sure it's safe, number one. And then number two, to make sure it's high quality and effective, we engineer it to have at least 70% MUSE cells. And the reason umbilical cord tissue stem cells are actually safer than your own stem cells is because, let's just say one of the cells has cancer in it or becomes cancerous. Your immune system is going to clear out those umbilical cord stem cells within 3 months. They're gone. Like this, there's been many studies on this. Like they don't stay in your body. Your immune system eventually recognizes them, and they're eventually taken up by your immune system and processed. So they're not going to cause any sort of ability to turn to cancer or tumors, and that's why I like the safety behind it as well.
So that's one. Also, besides that, if I'm not mistaken, you also do let's say a skin biopsy and somewhat use Yamanaka factor system, reintroduce that to the body to become whatever it's necessary. Can you tell us?
Yeah, exactly. So there's MUSE cells, which are pluripotent, and then there's the Yamanaka cells, or iPSCs as they're called, which are also pluripotent. Now, the iPSCs that we have, because we are doing research with University of Toronto right now, and we're just doing analysis of those cells. But essentially, the technology and the company we're working with, they have a patented technology, so it prevents tumors or cancer. So it's a gene edit inside of the Yamanaka cells. So if the cells start growing uncontrollably, it will stop them from growing. So it's a kill switch built into it. So basically, these Yamanaka stem cells can be programmed to turn into, for example, beta islet cells. So that's one of the studies we're going to do, is we're going to program to turn into beta islet cells, which are the cells in the pancreas that generate insulin. And then that way you can transplant them into the pancreas, and then you can get new insulin-producing cells to treat diabetes. And this has already been done by a company called Vertex. It's being done in China now too. I'm not necessarily the first one to do it, but I believe we'll be the first group to really put it into a holistic way, which means we're going to treat the whole body from an autoimmune perspective and optimize the environment. And because you have to make sure that the microenvironment in which you're putting the cells in is favorable, or else the cells don't survive. And if the cells don't survive, then obviously they're not going to do their job. And that's why a lot of people don't get benefits too. Like, for example, in your case too, what we have a whole protocol we get people to do with peptides and other things to do before they do stem cells, because we want to make the microenvironment as favorable as possible. So when you do the infusion or when you do the treatment, the cells have the highest chance of success in doing what they need to. Obviously, now that we have MUSE cells, we have much better cells that can survive. But especially with the first generation umbilical cord stem cells, most of them die. In fact, more than 90% of them die within the first 24 hours.
Yeah, I also heard that. So, you became very suddenly, I guess, not suddenly, but you became very famous with your work with Tony Robbins, many NFL players, and you have a journey to Dubai with the owner of the tallest building, I guess. So I want to say to my audience, that you're not only doing that, to make people young, you're really treating untreatable injuries. That's very important. It's not just
Yes.
like what we hear, like, people like me or people around me, mostly in this biohacking world. It's not really spoken about that, I had a knee injury and you heal it. It's more like, oh, I want to live until 150 years old, so I did certain stem cell regeneration. But how you started is more treating a problem, knee, hip, whatever. So you're more looking into healing people rather than just making them young or beautiful.
Yeah, I think to me that stuff is like icing on the cake, It's just like a nice bonus that I get to do. Honestly, it's just a hobby of mine because I enjoy myself looking young and feeling young and having energy, and I want to live for as long as possible, ideally for a very long time. And so because I'm into it for myself, that I just share with other people. And then I started getting popular for longevity and anti-aging. But to be honest, that's not my really specialty. My specialty is interventional pain and sports medicine. And now because of stem cells and gene therapy and all the stuff we're doing, we get a lot of the most complex cases from around the world. We get long COVID, we get fibromyalgia, chronic complex regional pain syndrome. We get some of the cases like mental health things, like PTSD, trauma, and a lot of really challenging cases that they've been to 10, 15 different doctors, and we're the only ones that are able to help them. And I take a lot of pride in that, because that to me is really where I get a lot of joy, because I'm able to bring these patients back to functioning, or I'm able to help restore their life. I think treating the celebrities is great because it raises awareness, but obviously the thing that brings me the most joy is helping the people who are suffering and need the help the most.
What I like about you, Adeel, is that the way you're approaching is, if I don't treat the celebrities and if we don't make these big chunks of monies, I wouldn't be able to take that and put into research and make it more available for majority of the people who can also not afford. That's a beautiful way of approaching. Otherwise, it's just being famous and
Exactly. I call it the Robin Hood. It's a Robin Hood model. It's you're not stealing from the rich, but it definitely there's a redistribution in that sense, and that's the whole idea, and that's why I like this whole cosmetics and longevity stuff, because a lot of the people who are doing that obviously have the money to afford it. Yes, they're doing it for themselves, but at the end of the day, it's also helping someone else, because then we're able to do research and we're able to potentially reduce the costs for someone who's disabled or someone who can't afford the full price.
You also are offering so many more than just, local or systemic stem cell. You guys are really in the forefront of almost anything. You have gene therapies. I heard that you have I took a note, placental implant injection instead of NAD, so that instead of taking NAD infusions or pills and whatnot, it lasts like multiple months. You do have an upgraded exosome helping the person, whichever way they're applying. Treatment lasts longer. The exosome stays there longer. You work for the brain, to treat the brain, the vagus nerve, therefore the psychology of the person. You guys do face treatments, but in all of them, you're looking in a very advanced way. It's so it's so amazing. So for all of these things, so one would look to you from outside. If they don't dig in like me or like your patients or whomever interviewed you, they would think that, oh, this guy treats everything, so I don't know if they're legit or not. But when it comes to things that you're treating and the way you're approaching, I mean, it fascinates me. So let's talk a little bit about these gene therapies, because I never heard it before you were sharing. I think it was in Dave Asprey's podcast that I heard about these gene therapies. And I'm saying, oh my God, that's really, we're becoming a new generation of humans that we are really able to treat things. How are you guys doing these gene therapies?
Just to give a little bit of a history lesson on gene therapy, because people obviously get a little bit scared when they hear gene therapy. What happened with gene therapy is because the research started in the 1980s, and it was very exciting and promising, but unfortunately there was a case in the late 90s where a young patient passed away from a viral gene therapy, meaning they use a virus. So gene therapy just means you're introducing some sort of foreign DNA into your body, or you're editing your own genetics. And so viral gene therapy was the most common and is still the most common used. But viruses, have some risk with them. They're still fairly safe, but they have some risks, and they're also expensive. And so those are what were used in research, and that's what was used for a while. And then because of that incident with the young boy, they paused gene therapy research for like 10 years, and then they picked it back up, and then it started moving. People continue to use viruses. So our group, instead of using a virus, we're using what's called a plasmid. Now, a plasmid is just, think of it like exchanging cards. It's like I give you my business card, you give me your business card. That's a plasmid, just exchanging information. Where does it come from? It comes from bacteria. It comes from E. coli, but there's no bacteria in the plasmid. And it's just a mini circle, and hence the name of the company I work with called Mini Circle, because it's just a circular strand of plasmid DNA. And that plasmid DNA is very easy to work with. It's been used in the lab for over 20 years. But the problem with plasmids was that they have a very short life once they're inside of your body. So normally, if I injected a plasmid into you, it would only last for 1 or 2 days, and then your body would silence it, and the plasmid would stop expression of the gene. And so obviously you're not going to inject yourself every day or every 2 days with the gene therapy. That's not a product, right? Obviously that never got popular. But the scientists we work with at Mini Circle, Walter Patterson, he figured out how to make the plasmid stay in your body longer so it doesn't shut off. And this obviously took about 6-7 years of research, and there was a lot of work that went into it. And they figured out how to make the plasmid stay in your body so it stays active for about 1 to 2 years. So it doesn't get shut off right away. And why plasmids? Because plasmids are very inert, which means they don't have any effect on your immune system. They don't migrate anywhere. I would argue a plasmid is a lot safer than what they use in the COVID vaccine, which was a lipid nanoparticle vector, which is a vector to carry the mRNA, and that vector can migrate and cause all sorts of issues, as we've seen in lots of patients. So whereas a plasmid, it's a vector, which means it's used as kind of the mode to transmit whatever information we want, but the vector is very safe. And that vector, essentially, we can insert whatever gene of interest. So the first product we did was follistatin, because follistatin has been around for, again, 20 plus years. It's a bioidentical peptide hormone. Our bodies make it naturally. And as we get older, the levels decrease. And by doing follistatin gene therapy, the plasmid, you're essentially just optimizing your follistatin levels for 1 to 2 years. And that increases energy. It can increase strength and muscle, bone density, and it significantly reduces the speed of aging in your body, as we've seen in the clinical trial and with many of our patients. So it's really a longevity intervention at the core.
So basically, the existing follistatin is a peptide?
Yeah, you can just order it on the internet anywhere, but it's just a peptide, and it's a very short half-life.
Yeah, that's what I was trying to understand. So there's the existing peptide for whatever many years, but you're using a technology that make that peptide stay in your system longer.
Exactly.
Therefore, you kind of call it a gene therapy, because I use peptides and bioregulators. For none of them, we speak as like we're doing a gene therapy. So it comes when it's kind of switching something on to last longer. Especially, I think it's amazing for, especially, yes, for athletes, yes, for people who want to live longer. But, I have many people around me that I'm really trying to influence them that you need to do more weightlifting, you need to eat more protein. And believe me, it's really difficult to convince these people. So
Yeah.
it's kind of like making their life in a way that, I don't want to say easier, but healthier, because of the sarcopenia scare, because of in older ages, you fall and you break a bone or whatnot. So it's helping the muscle to how does it do though? Like, is it that endlessly the muscle grows? Obviously not. I was thinking for myself, and I was just like looking to the mirror. I have enough muscles. If I do that gene therapy, where would it take me? That was my question to
So
myself.
the reason a lot of women like it is because it has what I would say a body recomposition effect, meaning it improves the mitochondria function, so it helps with cellular metabolism. So it makes it easier to put on muscle, but it also makes it easier to lose fat. And so sometimes we see both. We see people gain muscle and lose fat, which is body recomposition. And that's one of the amazing potential benefits of follistatin. Not everyone will necessarily get significant benefits in body recomposition. Some people respond amazing and they put on 2-3 pounds of muscle, they lose 5 pounds of fat. Or some men will even put on 8, 9, 10 pounds of muscle, which is a lot for a guy, obviously. But then some people will have only a little bit of muscle gain. Consistently, we'll see a decrease in the speed of aging. So the subjective benefits aren't always, I would say, as profound as we want them to be, but the objective benefits of measuring your speed of aging and seeing the decrease of inflammation in the body is very consistent.
Yeah, I was going to ask, like, how do you know it's decreasing the pace of aging?
So we used True Age Diagnostic for the clinical trial, which was the Dundon Pace score and all that. But, there is debate how accurate that is. But the point is, if you use the same test, at one point, and then you use the same test again at 6 months and at 1 year, you can see at least you can track the progress. Now, I believe that there's a company called Generation Lab from Harvard that we're working with now for the next clinical trial because they have a more accurate way to measure aging, which is entropy and biological noise. And so we're going to use that one moving forward. But the point is, we have at least data that suggests that it's significantly reducing the speed of aging. And we'll confirm that with the Generation Lab technology as well. And I think, again, the big thing too is, let's just say, let's take away all the testing around it. If you have more strength and you have more energy and you have more muscle, you're going to live longer. Like, that's just a fact. Muscle and strength are very correlated with longevity, right? And so if follistatin makes you stronger and helps to put on muscle, that's going to significantly help your longevity. Follistatin inhibits myostatin. So the higher your follistatin, the lower your myostatin. And myostatin is an enzyme that sets a limit on your muscle. And so people have probably seen those big Belgian blue cows.
I was just going to say that these huge, humongous, just muscle cows.
Yeah, the jack cows. It's because they have a myostatin deficiency. So they have a genetic mutation and they make no myostatin. So we're not knocking out your myostatin. So you're not going to get like that. You're going to get a slight increase in muscle ability because it's like taking the brakes off a little bit. And that's it. And makes it easier to put on muscle. So you're not going to put on, especially for a female, you're not going to put on a lot of muscle. You maybe put on a few pounds if you're lucky.
After this follistatin, you have, when I saw you at the conference, actually, I was asking you about GHK copper, and you say, wait, we're coming for a new gene therapy for the copper peptide, correct?
Yes, that'll be for cosmetics, but also GHK has so many effects on gene expression and anti-aging. Copper peptide levels as you get older decrease as well. So if we can optimize them, we're hoping to see some significant benefits in terms of longevity as well.
No, I wasn't just focusing to the cosmetic thing. I think it's now known that it's helping over 2,000 gene in the system, GHK copper, if I'm not mistaken.
Exactly.
Therefore, you guys are going to do the same with that, what you're doing with follistatin?
So one injection just in the arm, just like a vaccine, and you do it every 1 to 2 years.
And it's going to help to what?
Yeah, we're going to measure aging, slow down aging. We're going to measure skin quality, hopefully see improvements in skin health. And then, just measure different kind of biomarkers of aging and subjective symptoms associated with aging, yeah.
And then you also are working on the Clotho gene and the LH. LH is the testosterone.
Yes.
Gene therapy, correct? But let's talk about the Clotho gene, because in the last conference I was at, not the last meeting, last A4M conference, they were talking a lot about the Clotho gene in a couple of rooms. They know there's the gene, but there's still not any intervention to switch it off, I would say. Clotho gene is the gene that is kind of causing the aging in a way?
So Clotho is a Greek word that comes from the one who controls the threads of life.
Okay.
So when they discovered Clotho, which was by accident in a lab, they realized that animals who have mouse in particular who have higher levels of Clotho live longer, And then they started studying it in humans, and they found the same thing. So people who have high levels of Clotho naturally live about 30% longer. They also tend to have higher IQs, on average, at least 6 points. And then it also protects against dementia, even if you have the ApoE4 gene. So there's a lot of potential benefits of having optimal levels of Clotho or increasing them. And so that's why Clotho as a target made a lot of sense. And we just did our first dosing of it last week.
Oh, wow.
And so far the results have been really, really good. LH has been a little bit tricky, so I don't know when that product will necessarily come out because it's harder than we thought. But Clotho so far has been really promising. So we're going to be using it for dementia, kidney disease, because Clotho can also help with kidney disease, but also for longevity and
More
anti-aging.
therapies you add to this list with that type of a gene therapy style, people would be less and less needing to take so many supplements or so many daily interventions.
Exactly. That's why I like these, because it's good for a minimalist like myself who's busy, and you just take the basics, and that way you don't have to worry about doing all these different supplements or injecting yourself all the time.
Tell me a little bit about that upgraded exosome that you were mentioning to other people.
Yeah, so these are derived from the MUSE stem cells.
Again.
They're called MUSE exosomes. So exosomes is when stem cells grow and we replicate them, they slough off, and they have the soup around them. And that soup is the exosomes. It has all the nutrients and all the what are called microRNAs and cytokines and proteins and growth factors that can signal to repair damaged tissue, to reduce inflammation, and have a lot of the positive effects that stem cells do. But exosomes only stay in your body at most for a few days. So a lot of scientists think they only stay there for maybe even hours or minutes, and then they're gone because they're so fast acting. They just act on the receptor, they send the signal, and then they're clear, and then they're gone because they're tiny little signals. And so stem cells stick around longer, which is why stem cells can have more potent effects. But exosomes can still be very useful for many, many things, including cosmetics, IV, and they cross the blood-brain barrier easily, so they can help with stroke and other neurological conditions. We use them in depression and long COVID for neuroinflammation, and then we use them for injections as well for like tendon tears or muscle tears and a lot of sports injuries. I would say is where exosomes work really well as well.
Obviously I did exosomes as well. I tried to do most everything. I have two friends actually, they're professors at university here, and they're in the cancer research and stem cell researchers. And they do some studies and research studies. And in one study was with mice to make them younger. So they made two mice get old with like sugar-induced whatever, I don't know these technical terms, and then for 30 days to one of these mice, they injected exosomes subcutaneously. And now it's their time to like dissect that mice and to see what's happening. They see a huge improvement in their brain size. Normal size of the mice, one became obese, the other one was fitter, and now they're going to be looking organ by organ.
Yeah, there's actually a study published just 2 months ago on extending lifespan with intravenous exosomes in mice, because obviously you can't do that in humans, but in mice you can see until they die, and they extended lifespan by 12% with regular infusions of exosomes, which would probably translate to doing exosomes every 4 to 6 months in humans. And so I think for longevity and based off the study there's definitely implications for using it for anti-aging, because it helps with something called PGC1 alpha, which is essentially a regulator of mitochondria biogenesis. And if you can help produce more mitochondria and help with mitochondrial dysfunction, you'll help with longevity, because mitochondria is really the root cause of aging, cancer, so many different things. Because everything is, we're learning that everything is metabolic in nature, like metabolic disease, and it all starts with the mitochondria. So if you can improve your mitochondrial health, that's one of the best ways to fight off chronic disease and aging. And we know exosomes help with mitophagy. Stem cells help with mitophagy as well, which means they help to repair damaged mitochondria. And then stem cells also have the benefit of transferring mitochondrial DNA, which is the reason that mitochondria becomes damaged and becomes dysfunctional is because the mitochondrial DNA accumulates damage.
When a patient comes to you, unless they have a pain, so they don't have a pain, they just say, hey, Adeel or Dr. Khan, I am very much into these longevity thing. I want to maybe not live longer, but I want to stay healthier as long as possible. What would be your approach? Do you just start giving these things, or you do some blood work, MRI? What's your approach to them?
Yeah, yeah, exactly. It really depends on where they are on their journey. I would say most of the patients seeing me have already done the basics, meaning they probably have already gone to, like Fountain Life or done some sort of, or Next Health, or, one of those companies where they've done blood work, they've done extensive diagnostics, they've done all the prevention stuff, they eat well, they exercise, they do the sleep, they stress manage, they do all the lifestyle optimization, they take supplements, they may have even tried peptides. And so a lot of the patients I see are already done the foundation, I would say. And so now they're looking for, what else can I do? And so after covering the foundation, then that's where, peptides and bioregulators is usually where I would start with most of my patients, because that's the easiest low-hanging fruit. And I think your audience probably knows a decent amount about that, because obviously you're well-versed in it. And there's been lots of studies on bioregulators from Russia, especially, about how they can help people live longer. And I think I'm a huge believer and proponent of them now, especially with so many different chronic diseases that are related to aging. And so we use that, I would say, as a starting point. And then it would come down to patient kind of budget and also their desire. And, if they're able to kind of do everything and they want to have the best, then, we'll offer, then usually they'll do a combination of, the intravenous MUSE stem cells, the MUSE exosomes. We also have umbilical cord plasma, which is high in MUSE cells as well. And umbilical cord plasma is kind of like therapeutic plasma exchange, where you exchange young plasma, but except it comes from the umbilical cord. And so it's obviously has more proteins and more anti-inflammatory signals that can help with aging.
Are you doing that like a plasma exchange with the system, the machines?
No, it's just an IV with the umbilical cord plasma.
So you're not doing like the plasma exchange therapy?
No.
Easier then.
Yeah, exactly. It's easier. I think doing plasmapheresis or in-use pheresis is the other one. Before stem cells is a good way to prepare your body for it. But we don't routinely do that at our clinic, but we'll recommend, if people have access to that, that can be something to do. Basically, so we do MUSE stem cells, MUSE exosomes, umbilical cord plasma, and then the Follistatin Gene Therapy. And that's kind of like, I would say, our anti-aging package. And then sometimes people will also do natural killer cells, depending on their blood work. And that's where we might do blood work. And I will order that test to look at their immune cell profile.
So hold on, what is that natural killer cells? Very interesting.
There's a really good company called Cyrex, Cyrex, and they have something called lymphocyte map. Lymphocyte is just white blood cell. And so they map out your entire white blood cell system and all the different cell types. If artificial intelligence is what revolutionizing technology, immunology is going to revolutionize medicine, our understanding of it. Because immunology has always been a black box, and it's becoming less of a black box, which means we're understanding it more and more. And your immune system is this amazing orchestra of soldiers and people helping to, cells helping to keep your body from getting cancer, from fighting infection, doing things every day. And so natural killer cells are part of your innate immune system, which means it's part of your initial response when you get an infection. And as the name suggests, it's a natural killer. So its job is to kill bad guys, to kill cancer cells that have become aberrant, and tell your immune system, hey, get this guy out of here. We need to take care of him because he's going to turn into a cancer. Or, hey, this is a pathogen. He doesn't belong here. We got to get rid of him. So the natural killer cell's job is to kill these kind of bad cells. And so as you age, your natural killer cells can become less in number, dysfunctional. Some people genetically may just not have enough natural killer cells. So that's something we can measure in the blood. And then often we'll do natural killer cells before the stem cells, because it not only helps to boost your immune system, it also has an effect on senescent cells, which are the zombie cells in your body. So natural killer cells have been shown to clear out senescent cells.
So you get these natural killer cells also from umbilical cord?
Yes, that's right.
Okay. So all the source is from the same
Yes, same donor, pretty much, yeah.
How I understand now your process is that you're not just doing the last and the biggest intervention. You have steps to come there.
Yes,
You do clean the immune system or the inflammation.
yeah,
You are supporting the system with peptides. You're
yeah.
cleaning the cells that you're putting back in. So you have a process instead of like many other clinics just jumping in and giving you the IV NAD or IV stem cell. You have a whole
Yeah.
protocol before.
I like to make it personalized as possible because even that test, the lymphocyte map test, I wish it was available everywhere, but right now it's only available in the US. And the reason I like it too is because they have something called the Treg to Th17 ratio. I won't bore everyone with the science, but basically it's a ratio of your immune system, how healthy your immune system is, so to speak. Because regulatory T cells, as the name suggests, they help to regulate your immune system. And as these Treg cells become dysfunctional and they decrease in number, then you're more likely to get autoimmune diseases and more likely to get problems as you get older because of that. And then that can also tell us if there's other interventions that we need to do, like you said, like peptides, bioregulators, like promote, upregulating your thymus gland, using bioregulators for that, doing different interventions to get your immune system ready as possible before doing the stem cells. So you can look at those type of ratios and that type of blood work to really make sure that the stem cells are going to have the best chance of success and patients are going to get good results.
How did you start these vagus nerve injections? This is very endearing to me because there are so many people stuck in certain pain, let's say, not like physical pain, emotional pain,
Yeah.
whether it's
Yeah.
PTSD or addiction or something that is not helping them to move forward in their life. Obviously, you're not a psychiatrist. What made you want to pay attention to that? Because it's very, very special area that honestly, not many people want to be involved into these things that it's hard to like measure, let's say. It's only anecdotal that you can take the feedback from the patient.
Yeah, I mean, it was pretty much what you said, which was that when you see people suffering mental health, you can't always see it outside. As a doctor or a clinician, you want to help these people, and I wanted to figure out how I could help. In particular, it started with one patient of a friend of mine, a colleague who works with us. He used to be in the military, and he had one of his ex-military special forces operatives had really bad PTSD, post-traumatic stress disorder, to the point where he was suicidal. And he had 4 kids, has a wife, and was kind of just struggling to survive. And this was after he went to war and was deployed and all that. And Canada, the country is very far behind in many ways. And one of the ways we're far behind is in our medicine that's available. And so with Canada, you can essentially just do therapy and there's drugs that they can give you. But if the drugs don't work, which they didn't in his case, then the only other option is medically assisted suicide, which is very sad to tell someone who has a family that you can just kill yourself because there's no other option for you.
Hold on. That's just the weirdest thing I've ever heard. Is there such thing in Canada? So if you cannot treat is it just for mental condition or for anything, like you have a terminal cancer?
Yeah, it could be for any, if now, patients have the right, it's called MAID, medically assisted dying. And it essentially allows patients to choose, I guess, the right to end their life. But I don't think they should allow. I mean, anyway, that's a whole other debate. But the reason I think it's a little bit, it's a bit to be careful or cautious is because
I think you're reading my mind, because what I'm thinking, if you allow someone who's
Exactly,
already mentally disturbed to kill themselves, I think that their first option would be trying to kill themselves.
Exactly. You have to try to help them, not to just make it easier for them to do that. So that's exactly what I was going to say. So he asked me if there's anything I can do. And like you said, I'm not a psychiatrist. And so I was kind of like, I don't really know what I can do for him. So I started doing some reading and research, and then I talked to some friends, and then I read about the stellate ganglion block, which has been around for 20 years in medicine, which is where they use an anesthetic to block the nerve, which is a stellate ganglion, which is around your neck here. And basically, it calms the nervous system down. It calms the flight or fight response, which a lot of patients with PTSD, their autonomic nervous system is dysregulated. So they're always in fight or flight, meaning their cortisol is dysregulated. They can get palpitations, they get nightmares, they have all these, they get anxiety, they get panic attacks, all this other stuff that can happen because of fight or flight. And so that procedure has been around for a long time and studied, but as a regenerative medicine doctor, I'm kind of like, well, this is just like a block. There's no real regenerative, there's nothing in there that's actually fixing the problem, right? I always like to fix the problem if I can, right? And so I was like, why don't we fix it by trying some peptides and exosomes? And so there's a doctor in the US, Dr. Matt Cook, who was doing something similar, but he wasn't doing it exactly the way I do it now. And so I learned about what he was doing, and then we kind of looked into it and started exploring how can we manipulate the vagus nerve, which also is a gateway to your relaxation system, and we know becomes dysfunctional, and without having to just block it. So that's where the exosomes and peptides came in, because they help to signal and restore signaling and restore nervous system dysfunction. So now instead of just having a block, we're using peptides into the stellate ganglion as well. And so it's kind of reprogramming the nervous system. So it's calming it down, but then it's also having this reprogramming effect. And then that way we see patients get long-term results, not just, 3 months or something. I've had many patients, it's been well over a year, and they're still doing well.
It's a bit courageous to be trying, but I think when you see someone in front of you that there's no other option, it's okay to try anything in a way.
I mean, it saved his life. After the procedure, he cried in the parking lot. My colleague told me, because he felt different right away. And then he's playing hockey. He's back to a normal life with his kids and his wife, and he's not suicidal anymore. So, I mean, just saving that one life was enough for me to be like, okay, well, this is clearly worth looking into.
So, Adeel, let's summarize everything that we've been through. So basically, my understanding, the way you look, because you're a young physician, I don't know how old you are, but obviously you're younger than me, it looks like. But, you're looking in such an innovative way. That's why you're also the CEO of your clinics, because you have to also think like, what do I do to be better than other people, also safer than other people, so that Tony Robbins, or one of the richest men in the world in Dubai, trust you and come to you. So your approach is whichever field you look at, whether it's the mental health or diabetes, brain health, systemic inflammation, facial regeneration, any of these, when you look at them, you try to find the mechanism that would work the best and the longest, instead of you asking the client, come, hey, I want you next week here or next month. You're not after that. You're after a long-lasting solution.
Yeah.
And with the newest technology. In all these clinics, the same procedures are applied, like let's say people who are watching me, so in Dubai in certain things and in Kabul certain other things, or you kind of have a system that more or less all of them are providing the same thing?
First of all, your summary is perfect. I think that's exactly what I do, and it's a good way to reiterate things. And then the clinics, I would say Lithuania, so the one in Europe, and the one in Japan are more specialized for cancer treatment. That's probably a whole podcast on its own, but they do something called immunotherapy. And they've been treating cancer in Japan for 20 years using cell therapy, the natural killer cells that we talked about, and dendritic cells as well, and a few other things. So they have a bit more specialty for that. Japan, also, the doctor we work with is a plastic surgeon, so she specialized a little bit more in cosmetics for the face and everything.
But other than that,
everything's the same.
Follistatin.
Yeah, everything else is the same.
So they can reach out to your clinic. It's
just eterna.health.
Eterna.health. Whomever would like to have any of these treatments and more, they can reach out to their customer service, I would assume.
Yeah.
I would love to come and see you. I don't know which location would be easier.
Probably Dubai.
Estonia seems pretty close to here as well.
It is.
Being in Turkey.
Yeah, there's direct flights, actually, I think that from a couple of hours from there, yeah.
I mean, thank you so much. This was such an amazing podcast. I mean, I could go for hours, but I'm sure you have other things to do. Let's stay connected. Yeah. These are so amazing new discoveries. I thank you for all the people who are looking for a good way of treating themselves instead of living in pain. So from everyone to me to you, thank you so much for being so innovative.
I appreciate that. Thank you for having me.